Hi CAM followers, welcome to another one of our lives this evening. We are really lucky to be joined by Philippa Mitchell, amazing rehab vet who's going to talk us through some cases with us tonight. And I just want to say I hope everyone's staying nice and cool in this crazy hot weather. I'm going to pass it to Philippa now, and we're going to start a presentation. So I'm going to just talk for a few minutes.
Good evening, everyone. How are you? I hope you're well.
You're fine.
And not cooking too much. Apologies, Esme's just reminded me that we have lots of parakeets outside our house and they are chirping quite a lot. So we don't have any birds enclosed. They're all flying around, but they are being quite noisy this evening. So we've got a little bit of background noise for you. But, you know, nice and back to nature and all of that. Anyway, this evening we're going to chat to you about rehabilitation for your arthritic dog. So I thought, first of all, I would just have a gentle introduction to a little bit about me and how I got into doing this. So I'm a qualified veterinary surgeon, and I have a scoliosis in my back. And in my 4th year of being a vet student, I went off to see the physiotherapist at a local clinic on the NHS. And I was really sore. And she said to me, would I mind having some acupuncture? And I was like, well, okay, I suppose that's okay. I'm not paying for it. Completely skeptical. And I floated out of there, and it was absolutely amazing for the pain relief side of things. And I still struggled with my back throughout the rest of my vet degree, and was quite sore, but the acupuncture really helped. So as soon as I was able to, you have to do a year in practice, I actually went on the foundation course to become a qualified veterinary acupuncturist, and then went on and did my further training and my GP certificate in acupuncture and chronic pain management. I did 10 years in general practice and really loved all my geriatrics and all my little pain cases that I saw, just making them feel better. But I kind of missed a trick at the beginning, and it took me a little while to work out that it's very well and good taking all the pain away, but if you're not exercising and getting up and doing things, then that's not going to help. So there was kind of like a little missing corner in what I was doing to help my pets. And I went and found an amazing human physiotherapist who did Pilates, and that really got me thinking about how helping strengthen our bodies and being more aware of what our bodies are doing is really helpful for managing both the pain, because you've got that muscle and soft tissue support, but also sort of realigning your body as well. So trying to take the pressure off the bit that's taking the strain because the other bit's sore, and making everything work a little bit more functionally from there. So I then went and did my training with the University of Tennessee Vet School. They come over to Europe, and I did my certified canine rehab practitioner qualifications, and decided that general practice, as much as I loved it, actually it'd be really great to be able to help more pets. And so I took the plunge and I set up a little veterinary clinic over in South Buckinghamshire, and we've just been getting busier and busier. And I met a very lovely lady called Michelle on one of my courses in America, and so she joined us last October. So she's from Canada, so she's also qualified in Western and Chinese acupuncture, and we both did the same physiotherapy courses. So that's just a little bit about me.
So we're going to have a little bit of plans tonight, aren't we? With all your qualifications, you definitely know what you're doing. Got all our bases covered.
Yeah, trying to get everything. I'd love to have done a residency in orthopedics, but I can't. I really can't face it at university for another 3 or 4 years. So I'm leaving that one to someone else. And surgery was never quite my thing either. I didn't mind doing sort of spays and neuters and things, but anything bigger than that absolutely terrified me. So I'm quite happy to leave that to those braver than me and who enjoy the subject. So I thought I'd have a little bit of a chat with you about, if you're thinking about having some rehab for your pets, how you're going to get the most out of your appointment. So ideally, when we have our patients come to see us, it would be lovely to actually have a diagnosis. So, if your vet says, oh, actually, it probably would be a good idea to have some x-rays done, do take that on board and have a little bit of a think, because sometimes we have patients come in and we have a rough idea of what's going on, but sometimes we just really can't narrow it down. And, say you have a problem with a hip. Well, do we need to be thinking, is it so bad that everything's so worn away that we need to think about total hip replacement? Or is it just a little bit that's just a little bit sore? Is anything else causing a problem? So many different things that, can have the same symptoms that you outwardly see, but the treatment can be quite different. And so if you can come with a diagnosis, that is sometimes really, really helpful. Sometimes if pets don't come with a diagnosis, then we do sometimes have to send the doggies back and say, look, we need to have a CT scan, or we need to have an arthroscopy, or we need to have some x-rays done, and just a little bit of further investigation, because that helps us target the treatment and make sure that we're helping you to help your dog and treat your dog correctly. Which is really important. I mean, sometimes for the oldies, if they've got concurrent conditions, we'll sort of say, well, you know what, we think it's probably this, so let's try a few weeks of treatment. If they're getting better, fantastic, we'll carry on. We're probably in the ballpark of what's going on. But if we're not seeing an improvement, we do need to go and have a little look and a little bit of further investigation. So that's the time we might send you either back to your own vets, or say go and see one of the orthopedic specialists. So I also think it's really important to go and at least have a chat with someone who knows about all the treatment options. They might not be able to do all the treatment options. So our clinic, we don't do regenerative medicine, we don't do stem cell and PRP, but we can certainly have a chat with you about it if it was something that we thought might be useful for your pet and that you were interested in, and then we would refer you off. Lots of clients we see have just been going to see the person who does the acupuncture, and the person who does the acupuncture doesn't know about, say, the medicine side of things, or the rehab side of things, or the hydrotherapy side of things. So even if the person who does who you're seeing doesn't do the treatment, it's really helpful for them to know just exactly what options you have got available out there for your dog. We do also have quite a few clients who come in who have quite a fixed idea of what they want treatment-wise for their dog. And sometimes, we just have to sit down and sort of say, well, actually, when we met dogs who've had this problem in the elbow, then actually this treatment seems to work better in our experience. So I would definitely keep your options open and keep your mind open. Digest what your practitioner tells you, and then and go home and have a chat with them about it, and have a chat with your family about which is going to work best for you. And sometimes it is a case of trying something and seeing if it works, and if it doesn't, having a little bit of a rethink and then trying something different. There's no one fits all kind of treatment regime for our pets, and we really shouldn't be just having a recipe book for our dogs. At our clinic, everyone is treated very much as an individual. And so each program, whether they're, an 8-year-old Labrador who has crappy elbows, the same as, the next Labrador that comes in, after their examination, we might find that they just have slightly different wants and needs. So we'll tailor the program for them. And it's really important, really, really important to make sure that you have regular reassessments for your dog. I just can't stress that enough, really. Lots of people go and have their 10 sessions of hydrotherapy, and no one sees their dog back until at the end of the 10 sessions. Well, as an owner, how do you know if it's working? How does your vet know that it's working until they see you 10 sessions down the line? And what if you spent your money on your 10 sessions and actually there hasn't been an improvement because you're not targeting the right thing? So that's also quite an important thing. So when we see our patients, the first thing that we do at our assessment is a pain assessment. Lots of dogs come for hydrotherapy, say they've had surgery for their arthritis, or they are really struggling with their joint pain. If we're feeling sore, we don't tend to go and do lots of exercise. Yes, having a float around the water is very nice, and it can be pain relieving. Just doing that. But if we're going to do hydrotherapy, my view is that we're doing it for a slightly more of a benefit for actually getting the muscles and the joints and the tissues and everything strengthened and working to help support those joints. So we'll often, I would say probably 8 out of 10 cases that come to the clinic, we need to get their pain under control first. I wouldn't want to walk down the road and do home exercises or, you know, do hydrotherapy without feeling really comfortable first. And there's enough ways in the veterinary world that we can make your doggy comfortable, so they don't have to be sore. And lots of our owners come in after a few weeks of pain treatment and tell us that their dog's more active anyway, which is absolutely fantastic. So that's always got to be biggest priority going forward, is pain relief. And then the second part of the treatment plan is to try and get the muscle and all the soft tissues strengthened. And then off they go. So you can have your downward spiral with your arthritis, but we also see a really nice upward spiral. So we treat the pain, so the dogs are more active, so they build more muscle, so they're more comfortable, so they're more active. And, you know, we've had dogs who, you know, could only walk sort of 5 minutes down the road, then go up to doing, you know, sort of 30, 45 minutes in the park. Okay, so they're not ball throwing, but they might have a little trot and a canter just after something. So it's really, really nice if we can do a proper, you know, pain relief and then muscle building. And, you know, I know that, you know, we've had lots of speakers on cam talking about all these different things. So there's lots of different ways that we can help. And actually, it is a multi-targeted approach. So a little bit of lots of things has a big effect overall. So probably one of the most important things is actually keeping your dog nice and slim and getting that weight off. So if your rehab practitioner doesn't know how to do it, then you need to contact your vets, and lots of the vet nurses love doing weight clinics. So do persevere with those and make sure they are, you know, you are weighing your dog, you know, really, really frequently, just to make sure they're staying nice and slim. I had a lovely Labrador a few years ago. She was 35 kilos. We got her down to 24 kilos, and she was a different dog, completely different dog. So her owner was absolutely over the moon because we really helped her get nice and slim and therefore more active. And it's one of the most important things that we can do for arthritis. We've obviously got your surgical options if you wanted to go down that route. So we've had a few dogs recently who've had elbow replacements and hip replacements for their arthritis. And that's certainly an option and an appropriate option for some of our owners and pets. And obviously we've got sort of things like your modalities. So that means your sort of laser treatment, radial shockwave, all of those kind of things. We've got your exercise. So that means actually helping you work out how much your dog should be walking and how best to do it, but also a home exercise program as well. So for some of our doggies that can't walk very far, we can do some strengthening exercises, which are just standing ones, and we can get you doing those at home. Sometimes we can actually get them dogs doing them actually while they're having their food, so they can stand there and eat their dinner or their breakfast while they're actually doing some of the exercises. There's a whole range of medicines and supplements, and I know that's been covered on CAM as well. So if you're going to your rehab practitioner, you know, they need to be up to speed in, you know, what has come out, what medicine that your dog's taking that might interact with something else that they're having, what that might have an effect on their condition. So we have one doggy who's Addisonian and has got arthritis. So he's having some steroids, and that does make his muscle weaker. So we need to take that into consideration when we're organising his exercise program. You'd also ideally like to go to someone who can do some manual therapy. So we'll see later on with Toffee, the golden retriever, actually how the manual therapy was really, really helpful for helping her. So as I said before, we don't do regenerative medicine, but it is an option, and we're very happy to send clients to see the orthopedic specialists who do that. So that's another thing that we can chat to everyone about. And then if they're interested, send them for some more chats with the orthopedic guys. You need to be aware of your concurrent conditions. So as I mentioned, we've got the Addisonian dog. We have a few dogs with Cushing's as well. And again, you know, we have to be a little bit more aware that we don't push them too quickly, because they do have weaker muscles and they do fatigue a lot quicker than your regular dog would come in. We've got ones who've got underactive thyroids, all sorts of things, diabetes, etc. So again, you need to find a practitioner or a practitioner that can work with your vet to organise your dog's arthritis rehabilitation program and take those things into consideration. And do keep your options open. You know, there are lots of different treatment options now, and what your friend who had their doggy down the road has had might not be the best plan for your dog. So, you know, try not to come into your appointment with a fixed mindset. Have a chat with your practitioner. They'll always be happy to answer as many questions as you want, either then or, you know, a follow-up, and have a chat with them and see what options there are. A good practitioner will talk you through the pros and cons of each. So we have quite a few clients who come from quite a way away. So coming for laser twice a week, you know, for a couple of weeks to get started actually is quite a challenge for them. So we might suggest that actually maybe having some medication might be better. And that might be a cheaper option for them as well if there's, you know, finances have got to be taken into consideration. Or we might do something like acupuncture, which is a once a week treatment, or a radial pressure wave treatment, which is every 1 or 2 weeks to do. So, you know, keep your options open, have a chat with your practitioner, and they'll help you choose the right treatment for you and for your dog. And don't forget, you know, treatments are individual. What works for one dog might not work so well for your dog. So, you know, sometimes it is just a matter of you've got to suck it and see, do a few treatments and see how we're getting on. And if it's not working, have a little sit down and a rethink and choose something different and see whether that works for your dog better. Really important. We see lots of dogs who see to have physio either in their clinic or go for hydrotherapy, and no one reassesses them. All of our patients, they only get seen by vets when they come in. We always have a quick chat. Obviously, it's in the car park at the moment because of the coronavirus, but we always have a chat about them, how they've been since their last visit, whether anything's happened. Have they gone running after that squirrel? Has the conservatory door attacked them? Has their little friend jumped on them? Did they have a dinner party and were running around too much? Has anything, you know, changed since their last visit? Have they had any different drugs? Has anything happened? Have they had an upset tummy, so they couldn't have their medications, or they were vomiting, so nothing stayed down? And then we'll do a top to toe examination and just make sure that everything is staying comfy. Because, you know, we are structures where our bodies change. You know, nothing stays static in our bodies. So, you know, what we might find one visit might be a little sore bit at a different visit, and the original one is feeling okay. So really, really important. I can't stress it enough. Just lots of reassessment, and, you know, obviously first and foremost to make sure that, you know, dogs aren't feeling sore. If you've come for your hydrotherapy appointment and, you know, you tell me that your dog went running after the rabbit across the field and is now hopping lame, well, we're probably not going to do your hydrotherapy that day. We're probably going to think about doing something different, because to do the hydrotherapy would probably make your dog worse and take a lot longer to recover from that little flare up. And, you know, arthritis is a chronic condition, but you do get acute flare-ups, unfortunately. And sometimes, you know, we can't help our dog jumping out the back of the car because they were so excited about going for their walk, and normally they sit there. You know, we can't help the fact that it's always the husband or the father-in-law or something who comes and looks after the dog for that evening or the weekend that decides that the dog's looking great and starts throwing the ball for them. And then, you know, we get the Monday morning phone call saying, oh, they're really sore. So, you know, first and foremost, always got to be pain. And then we'll have a quick chat with our clients about, you know, what's happened since their last visit, and has anything happened since their last visit? Have they got better? Have they got worse? Have they stayed the same? You know, we want to make sure that, you know, our treatments are working. We don't want you to be spending your time and your money and, you know, not having your dog improve and feeling sore. That's just not good practice.
Philippa, do you use pain scales in your practice to monitor progress of patients?
We tend not to. I find that actually I haven't found them that helpful, I have to say. And because we see our patients so regularly, so most of the arthritic ones, the dogs with arthritis, are coming every 1 to 2 weeks. So we get to know their bodies so well that with our owners, we can normally work out how they're feeling. And our owners are so much better because they are living with their dogs. And, you know, they're seeing them day in, day out, hour in, hour out. We see them for just a finite part of time. So I'll always go with what the owners will have told me since their last visit, and then combine it with what I'm seeing on that day. So so I have used them before, but I haven't found one that I really like yet, because I think as well, pain is also how you feel it.
Yes.
So, I can have two dogs, they're both Labradors like Rufus here, and they both have really sore elbows. One is wagging his tail and still wants to go for his walk, and the other one is just as lame but actually sat in his basket feeling rotten. Yes. And actually I worry a little bit more about the one that sat in his basket not enjoying his life, more than what I call my happy limpers.
Yeah.
And I don't think that the pain scales take that into consideration quite so much.
Yeah.
I did do my own one, which I quite like, which is kind of a little tick box one. So sometimes we'll do that. But yeah, generally, because we're seeing these guys quite often and get to know them quite well, I feel that we kind of have a pain scale in our head.
Yeah, using their behaviour.
Yeah, and how they're feeling on the day when they come in as well, and how they've been.
Yes, definitely, yeah.
And we have, really good relationship with our owners as well. So, they'll tell us, if they have had a bad day.
Yeah.
Yeah, absolutely. So I've just got a little video of Rufus. So he was about 8, I think, when he came in. And he's had some cruciate surgeries, but he also has really, really bad elbow arthritis. And I kick myself now because I never took a video the first visit. And he was pretty much 3-legged for his first visit, unfortunately. So this is a little video of him improving. We had a bit of a jiggle with his medication when he first came in, and we started him with some hydrotherapy and some acupuncture once he was ready. And then you can see the difference from him as we go. So I think one of the really interesting things about that video is actually the last one. He just looks so much happier.
Yeah, he does see the waggy tail, can't he?
Yeah, he was quite a sad little chap when he first came. And I just don't think that the pain scoring quite takes that into consideration. So he still had a limp, but just so much happier. So we were really happy with him, and he continued on and did really well.
Brilliant.
Oh, sorry, next one. And so we're going to have a little chat about Toffee and Dave. So Toffee's owner couldn't join us this evening, unfortunately, but she's one of what I call our golden oldies. So she's currently a 15-year-old golden retriever, and she's got quite a lot of arthritis in quite a few joints, which is, not uncommon for what we see. Most dogs come in at least 2 joints affected. If they're over sort of, 8 or 9, then often more than that. And I think part of the problem is that they get one bit that becomes sore, and then they start weight bearing on other bits and making them work harder than they should do, or that everything gets sore. posture's out of alignment, you know, the walking looks odd, and everything's trying, you know, some things are just working twice as hard and other things are just getting weaker because it's too sore to move them. And then we're going to have a little chat about Dave. So Dave is pretty much a typical case. We've got lots of Labradors who come and see us, and lots of elbows, arthritis for those guys. So they're both fairly typical of what we see at the clinic. So we'll go and have a little chat about Toffee first. Here she is looking very happy. So we met Toffee in October 2018. So her owner was interested in acupuncture because she'd had vestibular disease. But actually there isn't that much evidence that it works that well for vestibular disease. It's quite good to help with the nausea. But we saw her a little bit, you know, after she'd actually had the initial episode. She was just a little bit sort of wobbly and quite stiff. She'd been the vet nurse at Toffee's general practice clinic actually does some physiotherapy there. So they'd put her on some anti-inflammatory medications and some tramadol to try and help with her pain. And she had a few physiotherapy exercises to do, mostly passive range of motion with the vet nurse, and was also having laser. Again, Toffee was just having monthly monthly checkups for her medications, like most of the practices around here tend to do. And so she wasn't being seen in between. So our findings were that actually she had quite a lot of arthritis in her toes, in her carpi, which are her wrists. So you can see there's a little bit of saliva staining over there where she'd been licking because they were sore. And she also had quite a lot of arthritis in her elbows as well. She probably has some spondylosis. Obviously, she's not been x-rayed for that, but she was quite stiff through her back and lots of really sore muscles and quite a bit of muscle wastage as well. I think because of her change in posture, she had really, really sore sacroiliac joints. And that's not uncommon, an uncommon finding that we see in the clinic when dogs have been limping. So your sacroiliac joints basically are sort of where your pelvis and your coccyx meet. And they can be really niggly, because I also have that problem as well. And it's really uncomfortable sometimes. So what we did for Toffee is we recommended that she have her other arthritic joints that we found treated with laser at her own practice. We asked their own practice whether they would be able to do some manual treatment for Toffee's joints and tissues. Unfortunately, the vet nurse who was looking after her wasn't trained in those, so her practice were very happy that she come back to us for those bits. We organised her a home exercise program as well, and also we did a little bit of e-stim for her, which is kind of like slender tone for doggy muscles, and to try and help build everything up as quickly as possible. We did start doing some hydrotherapy with her, but it was quite a few weeks after she'd started with her physio and her laser, because she just would have been too sore to start it. So we saw her about 2 weeks after her assessment, and she was already feeling more comfortable after her laser treatments. So we got in there and did some joint mobilizations and started tackling those sore sacroiliac joints for her. And she continued with fortnightly physio sessions. And then once she was comfortable, started on the underwater treadmill. And then while we were trying to build her muscle up, we did weekly hydrotherapy sessions, and then worked out a good program for her when she would have her physiotherapy. So when she was starting to get sore, we would also book a slightly longer appointment and she'd have a physiotherapy session as well. Obviously, she's an older doggy. So, you know, there were a few little blips along the way where she did too much, or, you know, just had a bad day. And sometimes there's no rhyme or reason why they get the arthritic flare-ups. But we treated her accordingly. And, you know, if she was too sore, we didn't do her hydrotherapy. And if she needed a laser physiotherapy treatment or a laser treatment at her own practice, we just recommend that she would go and have those done, just to try and help get everything under control and get her back up and running again. Her owner didn't come and see us last summer and winter because her other doggy was very poorly. She's got 2 golden retrievers. So she contacted us again earlier this year in March to say that she was licking her carpus again. And so we had a chat with them about some additional medication for her, which her general practice organised, and then starting her on some acupuncture as well, which she responded really well to. And we noticed that, you know, just happier doggy. She was really struggling just to get up. You know, she was lying down. She was really having problems trying to get up from the floor. So as she felt more comfortable, we just helped her with a home exercise program and some hydrotherapy. And she's doing really well again. So Toffee actually had her 15th birthday a little while ago. So about a month ago. So we were really pleased. Her birthday's actually the day before mine. So we had a little birthday chin wag and exchange of emails and birthday pictures, which is really nice. And we're still seeing Toffee at the moment. She's coming about every couple of weeks for her acupuncture and her hydrotherapy, because her own lives about an hour away. So she's still got a home exercise program to follow, and we adjust it according to her progress. So she's, you know, finding everything too easy, we'll just start making everything a little bit harder so she continues to progress, which is not pretty good, you know, considering she's 15.
I think,
you know, the golden oldies do take a little bit longer to build up muscle.
Yeah, it's a good lesson though, isn't it? That just because they're 15 doesn't mean we shouldn't be thinking about all the alternative treatments we can do.
Oh goodness, no, absolutely not. We've got quite a few who are in their sort of late teens and still going strong, and big dogs as well, not just the little ones. So we've got quite a few, you know, of the bigger dogs who are doing really well. So it's lovely to see. And, you know, we've had dogs carried in from the car park, not even being able to walk. And yes, you know, we might not get them back to doing agility or anything like that, but if they're happy with a 15-minute walk around the parks, you know, and, you know, good quality of life, then that's all we can ask for. I mean, you know, if I'm in my 100 and something, I'm not going to want to be running around after the ball, but, you know, a nice little walk down the road and back to collect my newspaper would be perfect.
Yeah, absolutely.
Right. And then we're going to have a little chat about Dave. So Dave is actually owned by a general practice vet, and I see a few of her clients as patients. And Holly and I had a little bit of a chat about Dave on and off before I actually saw him, and we had a little bit of a chat about medications and things. But we finally got around to meeting Dave in February last year. And typical Labrador, he'd had some elbow pain since he was 5, had the occasional little flare-up, which used to sort of, you know, settle down. But Holly got in contact because actually the lameness was actually becoming a little bit more prominent and was lasting a little bit longer, whereas before it might be a few days that he was stiff. It was just not, you know, seeming to settle down. So our findings were he actually had quite a lot of muscle wastage over his right forelimb, and those muscles are really quite sore. So if you've ever been for a massage and they go over and they're using the same pressure, say, over your back, and you suddenly go, ouchie, you've probably hit a little knotty bit that's really, really sore, that we often call a trigger point on there. So he had quite a few of those over his forelimbs. He didn't have too much in compensation, which is really nice, considering, you know, he was a younger dog when this all started happening. So that was really good. But he was a little bit sore lower back, so he was quite sore to extended hips. And if you ever stand up and put your hands on your coccyx and try and stretch out your leg behind you, you don't get that far without actually having to use your lower back. So quite a lot of dogs who come in from our practices, actually their hips aren't too bad. They often have lower back pain. And, you know, we can do x-rays of hips and things, and actually the x-rays are beautiful, and you see a grand spanking bit of spondylosis or something in lower back, which we assume is causing the problem if the hips are looking okay. So Dave was sore when we fully bent his left elbow, and he wouldn't let us fully bend the right one. So I could feel that it probably could go further, and we never pushed them, we never make them scream or anything like that. If you're subtle and go nice and gently, your doggies will tell you when they're starting to get sore. And what's the point in making them feel uncomfortable by going all the way and making them scream and things like that? So we always just take their word for it. And he didn't want us to go past about 90% of bending on that right one. And then he was sore over his last couple of vertebrae in his back, and he didn't really want to stretch out his hips as well. So part of the reason that he might have a little bit of a sore back as well is if you've got your 4-legged dog and you've got 2 sore front legs, what are you going to do? You're going to shift your weight backwards. So everything sort of, back and hind limbs will be working harder than it should do. So you get lots of compensatory issues sometimes. So this is Dave's x-ray. So this is his right elbow. So he's lying on his side, and so his paws down here and his shoulders up here. So you can just see a little bit of arthritis just going on in there. It's not the best photo in the world because the detail's not great, but there's just a little bit of a niggle where that should be looking nice and smooth. You can just see that little bump on there. So Holly is obviously a very busy vet, and she's a mum of 2 lovely kids. So she's quite a busy lady. So we got her started with a home exercise program that she could do on her walks and also in the house. She was really interested in coming for some laser treatment, and we also thought that would be a really good plan for Dave. So we do sometimes tend to find that some of our doggies have really sore arthritic joints. They can be stiff after their laser session. So for a first laser appointment, we'll often do like what we call a half dose. So we won't do a full-on let's whap it, because sometimes they are a little bit stiff. So Dave was actually stiff for the first few weeks after his laser treatments. So we just gradually increase the dose up to the full dose over that course of a few weeks. And interestingly, if he has a flare up, we have to reduce that dose again. Otherwise, it will make him stiff for a few days. Holly has had a little bit of a jiggle around with his anti-inflammatories, and it's horses for courses with anti-inflammatories. I don't have a preference. It's whichever one works for your pet and doesn't cause any side effects. So what works for one might not work at all for another one. So, sometimes it is just a matter of just having a jiggle around, and it might take 3 or 4 to find out which one works for your dog. And again, we'll always, if we recommend a medication, we will see your dog back and we will make sure that is working for them. I meet, again, quite a lot of dogs who've started medication. The vets say, okay, right, come back in 3 months' time, and no one has reassessed them to actually see whether that medication is working. And there's no point in spending your money and giving your dog drugs if it's not actually having a benefit for them. So we have had Holly has had a jiggle around with Dave's medication, and we tried meloxicam with him, and actually thyrocoxib, which is Prevcox, seems to work best for him. He started to improve after the 2nd week, just not quite so limpy and a little bit happier in himself. It took about 5 weeks before Dave was ready to go in the underwater treadmill, because we really wanted him to stay nice and comfy after his laser sessions before adding in the hydrotherapy. So we continued on his laser program. So we normally start off with our laser program doing quite a few sessions per week for the first few weeks, and then gradually taper it off. Maximum you can go to is about 6 weeks in between laser treatments. Some of our dogs need them more frequently than that, and some of them are fine on 6 weeks. So we'll just adjust accordingly and see how they're getting on. As Dave improved with his home exercise program, we did make it a little bit harder for him and Holly, so that he continued to improve. And it took about 9 sessions for Dave to build the muscle up on his forelimbs. And that's great, building the muscle up, because it means if he's putting more weight on his front legs, then he's taking some of that strain off of the back ones, which is much better for his body. We still see Dave his laser treatment. So this is my colleague Michelle doing his laser treatment on Tuesday. So Dave is an awesome patient. At the moment, we're not allowed to have owners in, so he just comes in, lies there, and has some treats, and really enjoys his session. We normally see him about every 3 weeks. If he has a flare up, then Holly just gets in contact, and we'll see him a little bit more often as needed. And she promises me she's continuing on with her home exercise program. We tried Dave on Galliprant, and that just didn't work for him as well as the Prevcox. So he's back on Prevcox at the moment as well, and a couple of other medications just to keep his arthritis under control. We've tried stopping them, and we find that actually he goes backwards again. So he's staying on those for the moment. So I think Holly's going to join us now, isn't she, Esme, for a quick chat with you?
Absolutely. I will pop her on screen. Bear with me just 2 seconds. She should be.
Yay!
Hello.
Hello.
Because I want to have that lovely picture of Dave behind you both. So Holly, tell us what it was like when you realised that Dave had arthritis and he was only 5.
It was very disappointing because obviously, as a vet, that I see a lot of animals with arthritis, and then to have my own dog suffer from it, I knew what the road ahead would be like, and I was keen to start him on anything that I could as early on as possible to improve things. And I stopped the ball throwing, and I adjusted my exercise and things like that. And first of all, we tried joint supplements. Like a lot of people do, and all of the low risk things to try, and courses of cartrophen, which is an injection you give every week for 4 weeks, and that's the course done. So he had that for 18 months. Those courses saw him through. Every 6 months he had another course of those. So he was doing fine on joint supplements and injections for a while, and then he started to need anti-inflammatories. And then as time went on and he ended up being on 4 different types of medication, I thought, well, now's the time to think about the next step. Do I look at surgery or stem cell therapy or things like that, or a complementary therapy? And because I wanted to try something that would do no harm, which potentially surgery could if it didn't work, and there's not a lot of evidence that suggests that elbow surgery is the way to go for some dogs, I thought, right, complementary therapy I wanted to try. And so we went to see Philippa.
Yeah, I think you're absolutely right. The elbow is such a difficult joint to manage and deal with, and we know that elbow replacements is one of the most tricky surgeries out there, and with lots of complication rates. So it's nice to have an option out there that obviously works for Dave, that doesn't involve those risks. So how did you find the process of going to see Philippa and starting on the laser in the home exercise plan?
Yeah, first of all, there was quite a lot of commitment, and then working part-time and having 2 children. At the beginning, I had to go for the laser therapy twice a week, then once a week, then every other week. But I thought, well, Dave hasn't needed any other treatment in his lifetime. He hasn't had any other problems. And I had saved some money in a bank account for him. And I thought, right, now he really needs it. I'm going to put the time and effort into him. And I'm so glad we did. I sometimes had to take my children with me, and Philippa was very patient with that.
They are the best kids ever. They are so well behaved.
Because Dave was a little bit stiff after the first treatments, but Philippa had really reassured me and said, no, sometimes the ones that are stiff at the beginning shows it's going to work. And it really, really did. And then when he started the hydrotherapy, his muscle really built up, and I could really see a difference in him. And ideally, we wanted to extend his laser to every 5 weeks if possible. But after he had a couple of bad flare-ups, we thought, well, that's just too long for him. And we've got a really good system going on now where every 3 weeks he goes into Philippa. He knows what he's doing. He absolutely loves it. And now she has a cool mat to use in the summer. He just lies down. He has his head either on the floor, if I'm allowed in, on my lap, and he just lies back and goes, oh, and he just loves it. And then that day he's a bit stiff, but for the next 3 weeks he's so much better.
That's brilliant. And how did you find establishing the home exercise plan? Because I know for people that's one of the I think you kind of expect to go to a therapist and you're going to have all that work done in that session, and then you go away for 3 weeks and don't have to do anything, but that's not actually the case. So have you got any tips for people who are starting out on that road?
And I am definitely, like many, one who probably doesn't do it at home as much as I should do. But walking over poles is something that was advised. So I actually set up some planks down the side of my house. So that was a really easy thing to do. I just send Dave back and forward up the path alongside my house, and he knows to walk over them. So doing something that's easy to set up and you don't have to keep taking up and down, I think is more likely to ensure that you will do it every day. And another thing that he really likes is doing the press ups, which Philippa showed me how to do. So every time I'm chopping carrots for dinner, he'll come and stand by me because he knows he gets the tip of a carrot if he does his push-ups. So he really likes that. And then Philippa suggested the next step is trying to do it on a hill in a walk. So I try and keep some treats in my pocket so we can do a press up on a hill. We have to adjust it depending on if he's having a sore day. And I can't commit to all of the exercise that Philippa suggests. But I think find your favourite ones, find your one that you know that your dog will enjoy doing, and those are the ones you're more likely to do every day.
Absolutely. Thank you so much for joining us, Holly.
Pleasure.
It's really, really nice to hear. I know obviously you're a vet, but this is your baby, and it's very different dealing with your own pets, isn't it, than treating other people's. And have you got any just general tips for people who are just starting out on the arthritis journey, and how to cope with the fact that their dog's got a lifelong condition, and you know how you decided what options you wanted to go down?
I think not necessarily just Googling things, which unfortunately a lot of everybody's clients tend to do, is seeking out advice from a professional early on what type of either medication or lifestyle changes you can do. Even things like either starting joint supplements or easy changes to exercise, like cutting out a ball or doing more slow hill walks, things like that you can implement really early that can actually delay the onset of the pain would be really good. So seeking advice from a proper healthcare professional on where to go early on is a good start.
Brilliant. Thank you so much for your time today, Holly, and for joining us. I think it's added a really nice element to this. Just seeing it from the owner's perspective does add another whole layer to dealing with the arthritic case. I'm sure you can agree, Philippa.
Oh yeah, absolutely. I would say as well, it's probably not a very good business plan, but you know, if your dog is diagnosed with arthritis, just come for an assessment as soon as you can. Don't wait until they are struggling, because there's so much preventative stuff that we can help you with. And actually, we won't have to see your dog as much as we would do otherwise. So bad business plan for the clinic. So don't tell my bank manager that, because you know, obviously we have to see the really advanced ones far more frequently. But you know, if your dog's been diagnosed with hip dysplasia, elbow problems, etc., then you know, shout at us, come for your assessment, and let's get some plans in place. Even if it is just saying, okay, right, let's get some muscle built up, do your home exercises, let's see you in a few weeks' time. Yep, you're doing really well, come back in a month. So you know, we don't, for the ones who are very early on, have to do much often. So it's just a matter of, you know, trying to help you with your, as Holly said, you know, your lifestyle program. So, you know, avoid jumping, you know, throwing the ball, crazy stuff sometimes, you know, non-slippy floors, get a ramp for your car if you can, change things like that. Just some very simple things. And then, you know, your rehab practitioner can advise you on those. And then hopefully, you know, try and put off that progression of the arthritis as much as possible, as much as you can.
Yeah, absolutely, great advice. Right, Holly, thank you very much. You're going to disappear now, but thank you for your time and for joining us, and to just tell us all about your lovely dog, Dave.
Okay.
Bye, Holly. Right, I just thought, because obviously we've done 2 big dogs as a case presentation, so I thought it would just be quite fun just to meet little Luella. And so Luella's a Pomeranian, and she's had luxating patellas, which have caused some arthritis in her knees, and she's also a little dog with hip dysplasia. So Luella came in and started a course of laser treatment, and she's quite a nervous girly. So what we did with her is we did some home exercise programs for her, which her owners were absolutely awesome about doing. And she would come in, and we would see if she was happy just to stand on the ramp for the treadmill, and she'd get a treat. And then we'd go off and do some fun exercises with her. And then we'd go back once she was ready, have another little go on the treadmill. And after about 9 weeks of coming, on 9 sessions, I think, Luella was actually quite happy to go through the treadmill and then have a little walk in it without the water. But by that time, her awesome owners had actually been doing the home exercise program so religiously, she didn't need hydrotherapy. So here's a little video of Luella having fun on our gym equipment. And there's a quick picture of Toffee having her acupuncture, actually. She's a little snoozer. She falls asleep. And then, oh, there we go. Let's have a little video of Luella. So it's a nice hip stretch there.
Yeah, such a clever little girl, isn't she?
So I actually saw Luella last Friday for a laser treatment. So she's probably about 3 or 4 years that we've been seeing her now. So I can feel that her knee joints, her stifle joints are quite a lot thicker than they used to be, which is the arthritis progressing. But actually she's pretty comfy running around, and it's only a little bit stiff just occasionally when she gets up. And she's not on any medication at the moment either. So, if things change, we'll just adjust her program accordingly. And as I said, her owner is still brilliant about doing her home exercises. So a very rewarding case there.
Lovely.
So Esme, have you got any questions that you wanted to ask, or should we?
Yeah, so I can, I'll pop back up and I'll disappear the presentation now. So you can see my face again. There's some, just had my voice in the background here. So I've got a couple of questions that people have asked, which I thought was good.
Okay.
Connie has asked about her 15-and-a-half-year-old retriever. She's very mobile and happy until the past couple of months, trying to find meds that work for him. How long do you give a new medicine as a trial before deciding? She continues, meds seem to make him very lethargic and lose appetite. If you take him off, he's much happier. We tried separately, tramadol, metacam, galliprant, without great benefits so far.
So metacam, galliprant and tramadol are all slightly different drugs. So metacam and galliprant are anti-inflammatories. And I've definitely had to go through a few doggies, sort of 3 or 4 different ones before we've actually found one that works. And I do find some of them will get sort of what I call a non-steroidal hangover on them. So I'm actually the same if I have ibuprofen. It just makes me kind of feel a bit bleh. And so I actually find that naproxen works much better for me than ibuprofen. So I tend to avoid ibuprofen if I can. So generally, if we're going to do an anti-inflammatory type of drug, I would normally wait at least 4 weeks before deciding whether it does work or not. Because I think for, some of our old doggies, there's so much inflammation in there, it's going to take a good 4 weeks for it to settle down. So probably what I would do, depending on the patient, is I would maybe start them on it and then see them a couple of weeks later just for a quick check-in and a chat and see how things are going. Yes. If there's absolutely no progress whatsoever, then we might think about stopping it then. If there's a little bit of progress and they're feeling a little bit better, no side effects, then we might wait the full 4 weeks before deciding whether it does work or not, or deciding whether we're going to change. Tramadol, I have a lot of dogs who it just doesn't seem to do anything for, and they just feel zoned out. So I'm not sure that a lot of them actually find it pain relieving. I think it just knocks them out a little bit. So it tends not to be one of my sort of ones that I would try first. And again, it doesn't have an anti-inflammatory effect. So normally, if you're thinking about arthritis, the first thing we would do is try and target the drug at the site where the problem is.
Yeah, I was going to say that tramadol is more of an emotional drug. So if the dog is emotionally suffering, you might find that using tramadol would help. So if the dog was like refusing to get out of bed and wouldn't eat and won't go on walks, then that would be a good candidate to trial it on for a short term. But it's probably not going to do a lot for its general pain levels. Yeah,
it's not going to change the inflammation in the joint, because that's not what it does. And so all the drugs are a little bit different. So, some drugs I expect to work a lot quicker. And some drugs have quite a wide dose range as well. So, and some of them have more side effects. So for a couple of them, we might try a lower dose range to start with and see if that works, see them back a week later and then adjust it accordingly. So again, it's not a recipe book. All of them are treated very individually as to what their problems are. And also the drugs are very different, and they react differently in each dog as well. So yeah, lots of assessment though.
Working as a team with your vet and keep.
Yeah, absolutely.
Perfect. We've had Kezia's asked, what are insurance policies like for complementary therapies?
Oh, very different. And even within the same company. So some insurance companies, things like laser are counted under your veterinary fees, whereas sometimes they're actually counted under complementary. Sometimes acupuncture is complementary and sometimes acupuncture comes out of your vet fees. They're really different. If you're wanting to investigate from your insurance company, then give them a ring and find out what you've got for which bits.
Most of them will cover complementary therapies to some extent, and they just have different rules around it. So like you say, it's definitely worth investigating. Let's see what else we've got in terms of general questions. Laura said you briefly mentioned eStim. Can you explain a bit more about it, please? How it works, pros and cons, who it might be suitable for? Is it something that's widely used?
Oh, so yeah, it's quite widely used in sort of the physiotherapy world. The downside is that dogs are hairy. So you have to use, it's basically like a little slender tone. So you have some sticky rubber pads, and you have a lot of gel. And I tend not to clip. If they've come clipped because they've had a surgery or something, then that's absolutely fantastic. But if they're not, we tend to use a lot of gel, so it can be a bit messy. And you basically put the electrode pads on, and off you go. I can probably put a video on the camera of my horse having it, if that's helpful. Yeah. I don't know. Do you want to have a go? Okay, right. Let me see if I can find it. Hang on 2 seconds.
We've got people watching from America. We've got, we can see. What I'll do, I'll just disappear my camera for a second and you can see it.
I might have to read, hang on a minute, let's read it again. So you'll see the muscle moving in a minute. Ooh. Can you guys see that okay?
Just about, yeah. So it works like a TENS machine in a person.
Yeah. So similar kind of thing. So there's different settings depending on what you want to do. So my horse really doesn't have very much muscle on her bottom. So you can see the shiny bit is all the gel on there. And then we teach the owners how to do it. There are a few contraindications where you wouldn't want to do it. So don't go out at home and buy one and just slap it on your pet, because you can do some damage, the same as if you put it on yourself. But they normally cost about £75, I think, for the actual machine. And then we get you to get some special rubber electrodes that you can reuse, and you can just rinse at the end of it. And then some ultrasound gel, which is about £4 or £5 for a bottle. So that's quite nice for those dogs who need to build up some muscle but actually can't walk very far to start with. Or if they've had a surgery, they've had an elbow surgery or a stifle surgery or a hip surgery and things, and we just want to give them a little bit of a boost for their muscle. It is also pain relieving as well. So we'll send some nice endorphins around.
That's great.
But yeah, no. So I've had a cat who was absolutely fine to have it in the clinic, but didn't like it at home. So, and it's not all the dog's cup of tea. So we normally have a little trial in the clinic just to see whether they like it. So it's kind of like a sort of a tolerating pins and needles type sensation. So if you've used a TENS machine, it's quite similar to that. And then you actually watch your leg moving if you put it on your leg and your muscle contracting and things. And it's a little bit weird. I didn't think my horse would like it, but actually she didn't bat an eyelid. Was like, what's going on? Oh, that's all right. I'll carry on eating my hay. So she was quite happy. So,
brilliant. Yeah. So I think that's all the questions. I would just like to ask whether you have some just general tips, top tips that you'd give someone who's at the very start of their arthritis journey with their dog. Before they come to see you, what should they do? Who should they speak to? Where do they start?
I do tend to find that sometimes the vets are just like, well, yes, your dog's got hip dysplasia, elbow dysplasia, they're not limping, or they've been limping, but they're not too bad. Wait until it gets really bad and then come back and see us. So prevention is definitely better than cure. So, come in, the more muscle we can save from disappearing and the more we can keep that joint moving and the rest of your dog feeling okay, the less we have to see you. And obviously the longer, happier life that your dog has. So I would definitely say, go and find someone who, can talk to you about all the options, because I think so many times it's very fixed. You go and see the acupuncturist for one bit, or the physio for something else, or the chiropractor or the osteopath, and there's no kind of integration and holistic approach being taken. So, you know, it's absolutely fine. I was quite happy with Toffee that, you know, she had her laser at her general practice vets and carried on having that. That was no problem at all to me. But, you know, we could help with the other bits, and I could advise her on the other bits and pieces that would help her. So definitely if your dog's been diagnosed, you know, find someone who can help you. So although we have to get your vet's permission to see you, you can just phone us up and say, look, you know, I'd like to come for an assessment. We can sort it all out. We phone the vets and say, you know, look, Mrs. Smith would like to come for an assessment with Fluffy. Are you happy to do that? So they send x-rays, history, etc. Over. We can do our assessment, and then we can chat you through your options. You know, if your dog has been diagnosed, then it's really, really important you not to over exercise them. So, you know, and don't do the weekend warrior thing either, you know, where you do a half an hour walk every day and then they go and do a 3 or 4 hour hike at the weekend, and then they're really sore Monday and Tuesday, so you don't really do very much, and then you gradually build up. So little and often is the key. So keep them active, keep them moving. If you're finding that they're slowing down at the end of their walk, or they're getting stiff, or they're stiff, you know, they go home, they have a snooze, they get up, they're really stiff, that exercise is too much for them. So either you need to do less exercise, or we need to think about some ways that we can help you. It would help your dog with the pain relief so that they can do that. Because otherwise you just get, it's a big cycle that, you know, dog's fine one day, so it runs around, and then it's crippled the next day, so it does nothing, and then it feels okay the next day, and then your pain just goes up and down and up and down and up and down, and then over time it actually goes up.
Yeah, getting worse.
And, you know, I see people who, you know, say, oh, well, you know, I didn't want to put them on pain medications because they're too young. Well, actually, by the time you come and see me, when your dog is really sore, we're having to think about lots of different things, and, you know, really chucking everything at it to try and get it to a normal level of pain processing, because it's so sensitive, and it's, you know, to even touch sometimes can be uncomfortable. And actually, if we can get that settled down, your dog's going to have less drugs over their life. Yes, they might need some to start with. And, you know, lots of owners, you know, don't want their dogs on medications. That's fine. There are other options that we can do. So we're happy to investigate those.
Sometimes you need the meds to start, and then you start the therapies, and actually you can wean off the meds, but you shouldn't be. I always use this as an example, because my little sister had a lovely Malamute who developed epilepsy, and I remember when he first started seizing, that she said, well, I don't want him to go on to meds for the rest of his life. And I said, unfortunately, you don't have a choice in this situation, because his seizures are so bad that's the only way to manage them. And it just took her a little bit of time. And obviously, once she started on the meds straight away, she was a brilliant owner. But just the initial getting over that, you don't want your dog to be poorly and be diagnosed with a lifetime thing. And there's a real emotional element to that.
I know. Yeah. So yeah, my cat's just getting older now, and, you know, the arthritis is kicking in. It's very common in cats. And, you know, she's having her laser. She doesn't tolerate anti-inflammatories very well. She normally starts throwing up and gets a bit of a tummy upset. So she responds very well to laser, and she had her laser treatment on Saturday. And we got a little mouse on Monday. So she was obviously feeling good. We got the back legs of a mouse anyway. The rest of it is gone. So that seems to work for her. No. Yeah. I was like, well, there's a cat on the floor. There's like a tail and 2 back legs. So she was feeling good.
Oh, bless her.
Yeah, I think for that.
I think you've given us some really important take-home points here. What I've taken is to use a really good, be open-minded, go for broad spectrum things. So all of the different areas you can target, with it therapies, medications, home exercises, exercise, just general walking, what you should do and not do, food, weight management. There's so many elements to it, and having somebody like you involved who oversees all of that can be extremely helpful.
Yeah, all of those little things add up to one big improvement, and lots of them are very easy just to implement at home. They're not difficult. You know, we have lots of owners who, you know, they work, and we have to try and, you know, work around them and, you know, fit their dog in and their dog's needs to their lifestyle. So yes, you know, sometimes there is a little bit of a compromise, but normally there's a way of getting around it. So, you know, as Holly said, you know, putting the poles down the side of her house. So my cat has her poles out to the cat flap. So every time she goes in and out, she has to walk over the poles. Trying to get cats to walk over poles, that's always a fun one. So, why would I want to, make her do the exercises when she can do them herself? So, and she can do them like regularly. So, especially in this nice weather, she's in and out all the time. So yeah, she's doing her home exercises on her own.
So fit. Yeah.
Absolutely.
Yeah. Brilliant. Well, Philippa, I've had an amazing evening and I feel like I've learned loads. I've really, really enjoyed it. And thank you so much to you and to Holly for joining us and teaching us all about your approach. And I will put the links up to Philippa's clinic so that people can see where she works and see all the great work that she does. And yeah.
If anyone has any questions, drop us an email. That's no problem.
Yeah, brilliant. Thank you very much. And good night, everybody. Take care and thanks for joining us this evening.
Good evening.